When you're assessing the prognosis of a cirrhotic patient, don't get distracted by your AST, ALTs. These enzymes tell you there's an injury. Cool, we got it. But now, how well the liver is actually working, we got to use other labs for that. What truly matters is your biosynthetic function. And that's why elevated prothrombin time reflects the impaired clotting factor synthesis is super powerful, right? Because along with low albumin and high bilirubin, a prolonged PT is a sign that the liver can no longer keep up. And these lab values are embedded in every single liver failure scoring system. The bottom line is if you have a patient with CDs, ascites, and high PT, they need urgent management and likely a transplant evaluation. So, ascites, that's going to be your hepatic encephalopathy, your ascites and your caput medusa, that's going to be your portal hypertension, and the markers of poor prognosis are PT time elevation. Also, bilirubin and decreased albumin. These reflect the loss of the biosynthetic and excretory function. If you've lost these, then tough luck. It's not looking very good for you. So, 48-year-old man, alcoholic liver disease, presents with the jaundice and AST over ALT and elevated GGT, all this stuff. What is the best indicator of poor long-term prognosis? It's going to be elevated prothrombin time because then you can't synthesize your clotting factor, so the liver's declining PT is going to prolong. Powerful prognostic indicator. AST indicates injury but not prognosis. Low fibrinogen is seen in advanced liver failure, not as reliable. Elevated GGT, that's just alcohol use or biliary injury but not the functional capacity. Prolonged bleeding time measures the platelet function, not the liver synthesis. So who cares about the prolonged bleeding time? We care about the PT prothrombin time. I always like doing 3 steps to make sure that you never miss this question again. 1, recognize prolonged prothrombin time indicates impaired liver synthesis. Very crucial. So your PT reflects the ability to synthesize coagulation factors. Which ones? 2, 7, 9, and 10. And that's due to your hepatic dysfunction. You're not going to be able to synthesize coagulation factors. 2, elevated bilirubin levels reflect liver dysfunction, right? So in cirrhosis, elevated bilirubin indicates that the impaired hepatic excretion and metabolism is occurring. 3, thrombocytopenia and its relation to liver disease. In chronic liver disease, thrombocytopenia occurs due to splenic sequestration, and decreased thrombopoietin production from the liver. So while thrombocytopenia itself can be indicated for liver disease, it does not directly assess liver function, so it's better valued by PT. All right, well, there you go. Those are all little factoids and high yield things that you need to answer this question correctly. So be sure to hit the like and subscribe button if you'd like to have more free medical school content. Questions are coming every day as long as you guys keep a liking and a subscribing. We'll see you in the next video.